So are we expecting any more, Elaine, or do you think we could make a start?
I think we had about 30 on the list, didn't we, Alex?
Yeah,
Oh,
and it's being recorded, of course.
okay. Well, life can get busy sometimes, and so we understand if people can't make it, don't we? So, but yeah, I guess we can make a start. So, hi everybody. My name's Jeannie Hayhurst. I'm a cardiovascular specialist nurse and I'm the clinical lead for cardiovascular disease across Lancs and South Cumbria. It's so lovely that so many of you have joined this session. So thanks very much, and I really hope that you find it useful. I must apologise. I've been a little bit croaky this morning, so I'm just hoping that my voice is going to hold out for you. But anyway, so stroke prevention is everybody's business. Interestingly enough, when they brought out the stroke strategy back in 2007, this was something that they talked about, that it was everybody's business, and so I'm sort of digging back into history there a little bit by using this as my title today, but I'm going to talk a little bit later on how actually we can all make every contact count in terms of supporting stroke prevention. So obviously we'll look at that a bit later on. So yes, next slide please, Alex. So apologies for those of you that were at the World Stroke Day in October, because there are a few slides in here from that event. But I think this first one I couldn't have left out because as I'm sure you all know, stroke is very much preventable. Approximately 20,000 strokes in England alone could be avoided by prevention work on managing high blood pressure, finding people with irregular heartbeats and treating them effectively, by helping people to stop smoking, and also, very importantly, more wider use of statins. So the number of people we know being admitted to hospital following a stroke has actually risen by 28% in the last 20 years, which is partly driven by our aging population and lifestyle factors. But actually, the highest rise in admissions is among people aged 50 to 59 years, which is quite worrying, really, isn't it? And as it says there, up to 90% of strokes are preventable. So we could all be doing a lot more to try and prevent those strokes. Next slide, please. So if we look at stroke prevention or cardiovascular disease prevention, the same disease process happens if we look at how heart attacks are caused, how strokes are caused, and in actual fact, how some forms of dementia are caused. People often don't realise that some forms of dementia are caused through cardiovascular disease, but in actual fact now when we do, if anybody's been for an NHS health check, they will know that actually we talk about, sorry, apologies, my screen went blank then. We talk about risk of dementia and we raise awareness of dementia within an NHS health check. And it's because all of these conditions share the same risk factors. So I've just got a couple of pictures there, as you can see, about what actually happens when we talk about the buildup of atherosclerosis or hardening of the arteries. So you can see in those pictures there that on the left, there's a normal looking blood vessel with blood flowing through it very easily. And then that middle picture shows how the buildup of atheroma starts off with a tear or a rip in the lining of the artery. And that tear or rip then allows fat and cholesterol to accumulate, as you can see by the third picture. And we call that buildup of cholesterol, we call that plaque. And what happens over time is that obviously that plaque, if we allow it to, will grow and grow and grow, and will eventually just erupt, and that's when we get the blockage of a vessel. So, and why we talk about blood pressure and cholesterol being so important in the buildup of atherosclerosis is that it's actually high blood pressure that can cause that tear in the lining of our artery, and so it's high blood pressure that can start that whole process off. And then obviously, if we've got high cholesterol, then that's going to influence that build-up of that plaque in our arteries. So as we come on to talk about the importance of managing blood pressure and cholesterol, hopefully this slide will help you to understand why that's the case. Okay, thanks, Alex. Next slide. So if we think about our strategic aims around stroke prevention over time, this is just a little bit of a run through as to how things have progressed, really. So as I spoke about the National Stroke Strategy earlier, that was released in 2007, and that was really quite, I think, a landmark point, because there'd not really been much before that to guide us in terms of stroke prevention and stroke management. And in that strategy, it started to talk about raising awareness and managing risk in terms of stroke prevention. And that definitely helped to build on our focus around that over the years. And in Lancashire and South Cumbria, I became stroke prevention clinical lead back in 2016, and we started to do some work on developing a local strategy, and we released that in 2018, and it was a 5-year plan as to how we were going to focus locally on stroke prevention. And we talked about, obviously, prevention. We talked about detecting the risk factors. We talked about how we could correct those risk factors and perfect treatment in order to prevent strokes. Moving on from that, we sort of expanded our prevention approach across Lancashire and South Cumbria, and we sort of started to incorporate the prevention of heart disease alongside stroke prevention, and we sort of built on that strategy from 2018 and released our Transforming CVD Prevention strategy in 2022. Which you can see is still live. So we had a broader approach. We started to address health inequalities, because we recognised that there was a lot to be done in that area, and we also incorporated a focus on weight management within that strategy. And alongside all of this, we in the background, a stroke service specification was developed, and as you'll probably all be aware of that, and the last time that was refreshed was back in 2024. And as part of that specification, there is definitely recommendations within there about the assessment and review and risk management of the ABC, which I'm going to talk about now. And obviously, it incorporated all the advice around how we can guide people with lifestyle changes. Next slide, please, Alex. So this is our focus on our governance as it stands now. Although, as some of you will be aware, there's still a lot of changes going on within the ICB across Lancs and South Cumbria, and we know that we are awaiting a new structure to be released. So this could all change. This governance structure could all change in the near future. But still, we maintain our focus on the detection and prevention of the 3 main risk factors for stroke. So we're looking at atrial fibrillation, we're looking at high blood pressure, and we're looking at raised cholesterol. So we're always looking to see how we can improve our detection of those 3 risk factors, and also include how we can improve the management of them as well. So next slide, please, Alex. Okay, so we've got our current status here. These are some locally defined targets that we've set for blood pressure and cholesterol. You'll see there's none actually in there for atrial fibrillation, and I'll talk about that in a moment or two. But you can see at the top and at the bottom, we've got targets for those patients that are actually on GP registers that have got recorded high blood pressure. We've got a target as to how many we are actually treating adequately. So whether we've got their blood pressure treated to target, we call it. And you can see that our target this year has been 77%. And unfortunately, we're still not managing to achieve that. So our current status as of January 2026 is that we've got 69.01% of our patients who have got recorded hypertension that we're treating to target. So we're still well below that target of 77%. Now you can see at the very bottom there, there's a reference to us finding people with high blood pressure, so increasing the prevalence of high blood pressure. And we're doing quite well with that. So you can see at the bottom there, we've moved that from 17.5% to 17.6% as of January 2026. So we're really doing loads of work out there trying to find more people with high blood pressure and getting them on registers and getting them treated. But obviously, it stands to reason that the more people we find, then the harder it is then to get those people treated to target, because it's almost a little bit like going the wrong way on an escalator. That, you know, although you want to find these people and you want to add them to registers, you're adding to that burden of getting those people on registers treated adequately. So that's just something worth bearing in mind for us. And then those middle two lines talk about people that we're treating in terms of their cholesterol. So the second line talks about people who've got a Q risk score of 20% or more. So those patients who've had their cardiovascular disease risk assessed through Q risk, and that assessment has been over 20%. And it's how many of those that we're treating with a statin. You can see that we got a target there of 65%, and the minute as of January 2026, we are treating 62.5% of patients with statins. So we're not far off. We're not doing too badly there. And then the final column there to look at, row to look at, is that third one. So those patients with GP recorded cardiovascular disease whose recent blood cholesterol levels are being treated to target. And as you can see there, our target is pretty low actually at 47%. We've set it very conservatively, I feel, and we're close to achieving that. But I think that, you know, we should be aiming to be treating a lot more of our patients who have got cardiovascular disease with statins, because we know that the evidence behind doing that is really, really strong. And I'm going to talk about that a little bit later on when we talk about what you can do to help that. Okay, so next slide, please, Alex. So, as I mentioned, looking at the last slide, there are no targets relating to atrial fibrillation, and that's because we're already really doing quite well in terms of atrial fibrillation. So you can see with that graph on the left-hand side that green graph is showing our prevalence of atrial fibrillation in our GP registers, and as you can see, since these records began back in July 2018, we're gradually finding more people with atrial fibrillation, which is a good thing. We want to do that because if we find them, then we can treat them and reduce their risk of having a stroke. So you can see with the next graph, the purple graph, we're doing really well at treating those people that are at high risk of stroke with atrial fibrillation, because we've already reached that target of 90% there, you can see. Yeah, we haven't got any more targets that we need to set there, because we're doing pretty well. Incidentally, Aristotle is a tool that GP practices have access to, that provides them with a lot of data as to how well they're doing in managing a number of different long-term conditions. And so this is we developed our CVD dashboard back in 2018 to be able to report on this, so that practices could keep an eye on
Does that look like it's kicked her out? Oh, she's here again. Hold on.
Oh.
Sorry, I told you that my Teams was playing up, didn't I? Sorry about that. Have we got the slides back on?
Still on the same slide, Jeannie.
Oh, sorry. I told you my Teams was playing up. It just completely shut down there. Apologies for that. I can't see the slides, unfortunately. Oh, yes, they've come back on now. There we go. Okay, sorry about that, folks. Okay, so we'll move to the next slide, please. Thanks, Alex. So our focus around atrial fibrillation at the moment is that we are trying to make sure that those patients who have been prescribed warfarin in the past, we switch over to one of the new oral anticoagulants, the direct oral anticoagulant agents, where it's appropriate. And that's because we knew that we were an outlier for higher levels of warfarin treatment across the country. So we knew that we needed to make that shift. So on this graph here, the pale green indicates those patients that are now taking one of the new oral anticoagulants, whereas the dark green illustrates those that are still on warfarin. And as you can see, as time has been going on, we now have a lot less people that are on warfarin, a lot more that are on the newer agents. So you know, that's progressing nicely, so we're going to just continue with that work. Okay, next slide, please, Alex. So we're just going to talk now about blood pressure for a few minutes. So we talk about, in terms of blood pressure and cholesterol, we talk about the size of the prize. So this is a tool that enables us to look at where our position is in terms of managing blood pressure, and how many heart attacks and strokes we can save. And you'll see when we look at it on the next slide that actually 1/3 of people with diagnosed high blood pressure are not treated to target, as we've already spoken about. And this is leaving millions of people in England at a high risk of heart attack and stroke that actually we could prevent if we treated them optimally. We know that although we've worked really, really hard, that over the last 4 years, the progress has been limited, and you know, those optimal treating rates have still not returned to pre-pandemic levels. Every year we see that there is a temporary peak in our achievement in March that coincides with QOF. The QOF is the framework that primary care all work alongside, and they have to try and achieve their targets by March each year. And so we always see a big spike in March of the work that they're doing with blood pressure, but then we see that following that, throughout the rest of the year, there's a dip, and it doesn't recover again until the following March. And we also know from our dashboard that there's massive variation in how well we're treating patients between practices across Lancs and South Cumbria. And it varies from under 40% of patients treated optimally to up to 90% being treated optimally. And one of the biggest pieces of work that we've been doing over the last couple of years is we've been trying to reach out to those practices that aren't achieving the targets as well, and we've been trying to work with them to support them in improving that situation for their patients. So currently we're working with a group of practices up in Millom who were really struggling. And since we've been working with them, they've been doing amazing work. Once they were given a little bit of guidance, they've now started to really improve that percentage. So, you know, they're really happy about that, as are we. Okay, Alex, so if we look at the next slide. So this is the size of the prize. This is what it looks like for us across Lancs and South Cumbria. This is sort of refreshed twice a year. And you can see from that, back in 2020, when COVID struck, we were managing to get 72% of our patients on blood pressure medication treated optimally. And then you can see what happened when COVID struck. It had a massive impact. And all of a sudden in 2021, we saw that that management of blood pressure drop to 47.8% being treated optimally. So that was really very worrying for us. And I'm sure that we saw a spike in strokes as a result of that. And then you can see that the last time this was reviewed in June 2025, we're managing to creep back towards the 70% mark. So we were at 68% back in June, but we still haven't managed to get back to 72%, which obviously is our goal. But you can see moving upwards with that line, that if we reach 75%, 80%, 85% achievement of treatment to target, we can prevent all those heart attacks and strokes as indicated in the blue box below. And so, you know, we've got to continue to strive to do that if we're really going to succeed in terms of stroke prevention. But you can also see that it's a massive task for us. Look how many additional patients we would have to get treated to target, even to get to 75%. So that across Lancashire and South Cumbria would be 18,700 more patients. So it is a massive task. Primary care are working really hard at this, but like I said before, it's like an uphill climb for us. Okay, next slide, please. So, can you just click again for me, Alex, and then the narrative will come up on the left. Lovely, thank you. So what are we doing around blood pressure detection? Well, we're doing loads, and it's been really encouraging this last 12 months in particular. We had some national funding, excuse me, that we handed over to our colleagues in Heartbeat in Preston, who managed this pot of money, and they worked with a number of voluntary sector colleagues in a VCFSE-led case finding project. So basically they were going out and setting up lots of community events to offer blood pressure checks out there, to particularly areas where we knew there were health inequalities or our audience was hard to reach, and they had massive success with that. And so yeah, that was really encouraging, and obviously it would be lovely to carry on doing some more of that. We had a really useful and busy Know Your Numbers campaign back in September. and across the region, we got a lot, and we tested loads more people than we even anticipated we would. We went into workplaces, we went out to supermarkets, we did loads with that. And yeah, I mean, obviously the Know Your Numbers campaign is big in September, but really we should be looking at doing that all year round. This is our lovely community leaflet. This is our lovely blood pressure leaflet. And we co-designed this with the help of some fantastic stroke survivors. Heartbeat welcomed us into their facility at Deepdale in Preston. We had some stroke survivors that came along and helped us. We wanted to develop our own leaflet, and what we wanted to do was we wanted to say to service users, you know, what do you think needs to be in this leaflet? If people have a leaflet about high blood pressure, what do they need to be told? And so they told us what it should look like, and this was what was developed, and we're very proud of this leaflet. And whenever we're out in the community now, we use it, and it's got lots of information inside. But there's also the facility for people to record their readings in there as well. Last year we also got some national funding to run an optometry pilot. So what we've been doing is in 4 regions across Lancs and South Cumbria. We've been going into opticians. I've been delivering training to them as about how to record blood pressures. And they've been offering blood pressure tests to clients that have gone for an eye test, and anybody that accompanies them, their family or friends that accompany them. And so this has been a busy time for them. It's been interesting to look at the data we've received. I'm not so sure, you know, how it's going to evaluate at the end. It runs until the end of March. But we know we've been reaching out to another sort of set of people that actually makes sense to test them, because obviously when we go and have our eyes tested, opticians are looking for signs of blood pressure, high blood pressure in the back of the eye. So it makes sense that actually we're linking that eye testing with a blood pressure reading. So we've been really delighted to have the opportunity to do this. And like I say, I can't really report on the success of that, but we'll be looking at it after the end of March. Also, we had an interesting opportunity to go out to test blood pressure testing in a barber shop. And we actually did that in Lytham. We had a barber that was really keen to work with us on this, so we trained him, and he agreed to have a blood pressure machine in his shop and offer blood pressure tests to his clients. And we had some extraordinary results from that. We found quite a lot of people through that who had raised blood pressure, and even a number of them had to be advised to seek urgent help because their readings were so high. And interestingly, that barber found that his clients were coming in for a haircut and checking the blood pressure at the same time. So you know, we're sort of aligning the two, and yeah, we just love that. So we're wanting to roll that out. The barber himself has said to us that he's got lots of fellow barbers that want to take part, and so we're trying to develop a model that we can roll out to make that become more available. And then more recently, I've been talking to colleagues in particular across the Fylde Coast, which is where I live, about how we can expand on community blood pressure testing, and we've got access to a number of machines, and what we want to do is we want to offer them out to workplaces And we want to train up people within the workplace how to record blood pressures properly, but then what action they might take if blood pressure was raised. So, you know, we often hear that people say, oh, I haven't got time to go and get my blood pressure tested. So we're thinking that actually if we've got blood pressure machines in the workplace and people know how to use them, that could be a really good thing. So that's something we're looking at doing now. Okay, next slide, please, Alex. So in terms of blood pressure treatment this year, let's have a look how we're doing. So just starting off, before we look at that, obviously we said before that we're gradually finding more people with blood pressure, and our prevalence is up to 17.6% now. So since April last year, this is an increase by 0.3 percentage points, but actually what it equates to is 6,466 more patients on hypertension registers across Lancashire and South Cumbria. So that's definitely to be applauded, and we're going to keep cracking on, as you can see from what I spoke about on the last slide, with the work that we're doing trying to find more people with high blood pressure. However, since April 2025, unfortunately, we've seen an overall drop of patients that are treated to target of 0.16 percentage points. So as we talked about earlier when I showed you those targets, if you remember, we're aiming for 77%. In April 2025, we were at 69.17%, and currently in January that's dropped to 69.01%. So we do know that this has been partly due to some EMIS resets that's altered the way that the data looks. EMIS is the system that is used in primary care. But we are also hoping, as I spoke about before, that you know, in alignment with QoF, we will have a bit of an increase by the end of March in this. So you never know, we might get back up to 70 again. But it's obviously been disappointing that we've not been able to improve any more on that. We continue to work closely with our community pharmacy colleagues. They support primary care massively in terms of, you know, us directing individuals to community pharmacy in our blood pressure pathways. And they also offer the BP checking service, which supports primary care. So that's a really great partnership that we have with them. Also, as some of you will know, some of the community stroke teams have been doing blood pressure and pulse checks on stroke patients, which we've really appreciated their support with this. We know it's been challenging, and they've been doing those checks on discharge and at 6 weeks and 6-month follow-ups. So like I say, we've been really grateful for the support with that. And then finally, the other work that we've been doing this year is we've been looking to adopt a new medication pathway across Lancs and South Cumbria, and there's a picture of it here. It's still, unfortunately, still in draft form, but we are really hoping that very shortly we'll be able to get it launched out to primary care. We've adopted this from the Greater Manchester pathway, and basically what it looks at doing is it looks to advise on patients being treated with perhaps 2 medications at lower doses rather than 1 medication at a higher dose. And Manchester have found that this has been more successful in getting patients treated to target, and so we're really hoping that it will work for us too. So that's fingers crossed in the pipeline for us. Okay, next slide please, Alex. Okay, so the last thing to talk about, of course, is cholesterol. And we've got a fantastic lipids clinical lead in Mo Elnagar, who works up in Morecambe Bay. And Mo has done an enormous amount of work over the last 12 months. And this is just a few of the things that he's been working on. He's developed a statin myth-busting toolkit, and that's out there, which is it's a support toolkit for primary care. We know that there's an awful lot of myths around statins, and of course lots of people read the Daily Mail or whatever, and they talk to people, maybe friends or family that are on statins, and everybody talks about all the side effects and the problems with statins, but in actual fact, you know, there are less risks than people think around taking statins. Interestingly, there was a report on the BBC earlier this month. I don't know if any of you saw it. There's been a massive study been going on with around about 120,000 people involved, looking at the safety of statins, and it's actually reporting that, you know, all the worries about statin taking are really, you know, there's not a lot to be concerned about. That there's fewer side effects than people think. I mean, I'll happily share the link for that with you, because this is something that you could definitely share with your patients or your colleagues or whatever, because it's really important to share that. So another thing that Mo's been doing, he's a great educator, and he's developed a lipids discussion forum for health professionals, and you know, that's been really, really useful for them to get together to just talk about, you know, how we can get more people on confident to take statins. And of course, there's lots of other new lipid-lowering therapies on the market, and so he's trying to support health professionals on making sure that those therapies are used, you know, as recommended. And so, yeah, lots of people have found that really useful. He's also been working with colleagues in developing a laboratory guidance. So this is once again for primary care, and it's so that when they get their lipid results back from the path lab, that they get some guidance on how to respond to those results, and so that they react in the right way, and give the correct advice to patients about those results. But I think that he would agree that we still need to increase the uptake of NHS health checks to find those people, more of those people that are at increased risk of having a heart attack or stroke. And so that's definitely something that we constantly talk about. I deliver NHS health check training for Lancashire County Council, for Blackpool Council and Blackburn Council. And every time I go out, we talk about how we can get more people attending for their NHS health check. Because we know that if we could do that, we'd be able to help so many more people to reduce that risk of heart attack or stroke. Okay, next slide, please, Alex. So let's just finish off by talking about how we can make every contact count. And this is the first way, doing manual pulse checks. So anybody that's ever attended any blood pressure training that I've delivered will know that actually before we do a blood pressure check, we always advise that we put a finger on the pulse. We call it pulse before pressure. And you can see it's really easy to do. It's really easy to just do that simple check to make sure that the heart is beating like a clock, as it says there. So I've been going out delivering heart education to school children recently. It's been such a laugh, I'll tell you. I'm enjoying it so much, and I'm getting the children to even find their own pulse, and they can do it. So if they can do it, we can all do it. And so it's dead important, if you get a chance to do a manual pulse check, just to make sure that that pulse is beating regularly, then it's really, really helpful. As it says there, feel the beat to beat the stroke. If something just doesn't feel like it's beating regularly, then it's really important that that person just gets that check at their own GP's practice. It might be that it's nothing, but if we can find more people with atrial fibrillation and get them treated, we can prevent more of those really devastating strokes. Okay, thanks, Alex. Next slide. Okay, let's make every contact count in terms of blood pressure and cholesterol. Oh, can you just click again for me, Alex? There's a little picture there. Thank you. So maybe try and think about the check, ask, advise. So firstly, I think if you have been trained in taking blood pressures and you're confident to do so, then if you get an opportunity to check a blood pressure, then certainly do that and report to the GP if it's raised. So the National Clinical Guideline for Stroke suggests that anybody who's had a stroke that should have their blood pressure less than 130/80. Anybody who's not had a stroke, then we're looking for anything under 140/90. But that's just to give you an illustration of what we're aiming for. Another thing that you can do is, if you're patient facing, check that that patient is taking their blood pressure and cholesterol medication as prescribed. So unfortunately, we know that patients can often fall out with their medication and maybe stop taking it because they think they're having side effects, and we find this with statins the most. And it's really important that if they've been prescribed that medication, they are taking it. So if you get an opportunity to talk about that with patients, it's really, really worthwhile checking if they're taking it. And if they say that they think they're having problems with their tablets, then urge them to have a chat with the GP or the nurse about it, because it could be that that medication could be changed to help them. So rather than not taking it at all, it's worth that conversation. Ask them if they've been for their checkups at the surgery. They should get invited in at least annually to have their blood pressure and cholesterol checked. So just ask them if they've been for those checks, because it's really important that they keep up to date with that. And then lastly, just advise them on how important it is to keep good blood pressure and cholesterol control, because obviously we know that's important for people to prevent a stroke in the first place, but it's equally important for those that have had a stroke to prevent them from having any further events. So really important that you just advise them about that. And then I think we're on the last slide. Next one is Alex, I think. Yeah, this is the last slide. So finally, let's make every contact count. If we have an opportunity to talk about lifestyle, just very, very simple conversations could just help. So obviously, if you come across somebody that's still smoking, just talking to them about the benefits of stopping smoking, and maybe signposting them to where they can get help. About obviously the importance of a healthy balanced diet, and obviously we know that patients that have had strokes might not be able to take regular exercise, but obviously keeping active is really important for them also, even if it's doing chair-based exercises. And then obviously adding in there, maintaining a healthy weight is important in terms of cardiovascular disease prevention. And there's a few little messages there for you to see, just very small messages that you might be able to share with patients if you're patient facing, but anybody that you might come into contact with that might benefit from that type of advice. So I think that concludes. I think the next slide is saying thank you. And I guess if there's any questions, I'll try and answer them. But hopefully you've found that helpful. Are there any questions? There's no hands up. Everybody's gone quiet.
No, it's been very helpful. Thank you. Very good session.
Oh, thank you very much. Thank you. Any questions, anybody? No, is there anything that you know, you sort of feel like do you all feel like you may be able to use some of that let's make every contact count? Do you feel that that's something that you can touch on?
Yes, definitely. Yeah.
Yeah,
I
brilliant.
thought the barber thing was brilliant, but I don't need it. Obviously, I won't be going to the barbers, but but I thought it was brilliant. That was a great idea. Brilliant idea.
Yeah, it is. It is, and we know that that if there's opportunities for us to go out and do more of that, it would be really, really good. Elaine, have you got something to say?
No, it's just excellent as usual, Jeannie. I think it's really, really interesting, and especially when you bring in the COVID and how much impact it had on us all, and how long it's, you know, and how much it takes and the effort that's involved to get back up to where we are. So obviously these slides are going to we've recorded this and we're going to put these slides on the network website and also in the resources bit as well. So I think are all the links and everything okay to share as well, Jeannie? Are we okay to share anything out?
Yeah, what I'll do is I'll forward that link to that BBC report about that statin trial, because it's really interesting. You know, and I don't know if anybody did see it on the television. It was earlier on in February, but you know, everybody worries about statins, though they say about all the side effects, but it really illustrated, this report, how, you know, those side effects are few and far between, and that we should be sharing that message with more people, you know, and try and get more people to have more faith in taking statins. So I'll share that link and then you can pass it around. Yes, Alex.
Yeah, I saw that report.
Did
I'm on
you?
statins myself, so I was you know, pleased to see that report and been telling some of my friends,
Yeah.
because there are a lot of people out there, you know, not taking them because of the some of the myths out there, isn't there?
Absolutely. Yeah, absolutely. So yeah, I'll share that with you, and then obviously you can
I'll
all
add that
share
in.
it too. Yeah, yeah. Lovely. Oh, Alison, have you got a question?
Yeah, I've just got a question. So I'm Alison, I'm OT within the Enroll team, so Neuro Rehab Online. So we obviously offer kind of group therapy to people, particularly after stroke, across Lancashire and South Cumbria. And one of the things that does come up quite a lot is about when people are accessing our services and have obviously had a stroke relatively recently, it's a key time that people are maybe considering wanting to make lifestyle changes to prevent secondary stroke. So it's something we cover at the moment within some of our sessions, but it's also something that as a service we're maybe keen to develop a bit more of in the future as well. So I suppose I was just wondering if maybe it might be possible to kind of touch base or maybe share any other resources you think might be useful for us in terms of while we're developing content further in that area.
Yeah, so that's interesting. So I mean, we talk about this quite a lot when I go out and do NHS health checks, because obviously there's loads of services out there that you can signpost your patients to those services, but it's about you having, you know, those links, isn't there?
Yeah.
That's interesting. Let me take a look at that. I mean, maybe it could be useful to meet separately, and I will see if I can try and link you in with those services, because, you know, certainly if you can say, oh, there's such a service here and this is how you get in touch with them and this is what they'll do, it would be really helpful for you, I'm sure.
Yeah, I think that'd be great. And also we sometimes have kind of people who are from outside the service as well coming along to talk, particularly at some of our more informal like cafe and roll sessions. So we have Stroke Association coming along. And again, it just kind of thinking about if there's any other services related to the kind of prevention side of things that might be relevant to bring in as well. That'd be really helpful to know. Thank you.
Yeah, no worries. We'll catch up, Alison. Yeah. Okay. Anything else from anybody? No. Stunned you all into silence now. That's fine. Well, as long as there's no more questions, you've got a little bit of time back. That's great, isn't it? Get a cup of coffee or something now. And yeah, good luck with everything, everybody. You're all doing a great job out there, so keep cracking on, and hope you found it useful.
Great
Thank you
stuff.
very much.
Thank you.
Thank
Bye-bye.
you.
Bye.
Thanks,
Thank
Jeannie.
you,
Really
everybody.
good. Thank you.
Bye.
Brilliant.
Bye-bye. Thank you.